Antibiotics, medicines used to fight bacterial infections like skin or wound infections, urinary tract infections, and bacterial pneumonia, are the most important medicines we have to fight serious infections. The discovery of antibiotics, beginning with penicillin in 1928, was a significant advance for public health. Death rates from these infections declined drastically, and life expectancy rose. Unfortunately, bacteria are able to adapt over time. Many of the antibiotics we have to treat infections are less effective because bacteria have become resistant to them. If you view the bacteria's ability to develop resistance and our ability to develop new medicines as a race, we're way behind. For many years, people have used antibiotics inappropriately, such as for treating infections not caused by bacteria. And their widespread use in animal feed can cause problems for humans too. What causes antibiotic resistance? When you have a bacterial infection and you take an antibiotic, most of the time it is not very selective, meaning it can affect all the bacteria, good, harmless, and bad, in your body. Sometimes people stop taking antibiotics for a few days because they feel better. When this happens, the medicine kills some of the bacteria, but stronger or more resistant bacteria can survive. The low levels of antibiotics that are still in your body select for those bacteria that are resistant. These bacteria then continue to multiply. How does antibiotic resistance affect us? In recent years, antibiotic-resistant infections have contributed to a rise in more serious illness and deaths resulting from diseases that were previously treatable. Recovery from a bacterial infection may take longer, require a more powerful antibiotic or hospitalization, or more doctor visits. Antibiotic-resistant infections also create a need for more invasive or more expensive treatments. But there is good news. Researchers are investigating new classes of antibiotics to combat the growing threat of resistance. Doctors are receiving more information about the appropriate use of antibiotics. And healthcare authorities worldwide now offer guidelines to support these efforts. Authorities elsewhere are shifting the way they view antibiotic use in animals and animal feed. How can you help? Hand washing is the best defense against getting many types of infection, so do it often. If you do get sick, don't demand antibiotics. Antibiotics don't work on infections that are not caused by bacteria, such as infections from viruses. If your doctor says you have a non-bacterial infection, follow his or her advice. If your doctor does prescribe an antibiotic, take it all as directed to make sure the bacteria don't come back. These steps might seem small, but together with new prescribing guidelines, steps to limit usage in animal feed, and the development of new antibiotics, we will be better equipped to slow antibiotic resistance and preserve important medicines.